and some wisdom. I really appreciate it. I'm sure everyone else does.
Thank you.
I guess we'll jump right into it. You touched on the state of education in the country and the things we need to do. And just to use some of Dr. King's words, he once said that the walling off of Negroes and really all people from equal education is part of the historical design to submerge them in second-class status. Now, your Carson Scholars Fund and your Reading Room initiatives, they do a lot to fight the systemic and increasing educational gap among the haves and the have-nots in our society today. But what more do you think we should do, and we must do, to eliminate the institutional inequality and give Ben Carsons of tomorrow a chance to flourish?
Okay, excellent question. Well, you mentioned the reading rooms, and my wife and I have started. The whole concept being that a lot of children come from homes where there are no books. And in many Title I schools, for instance, there are no libraries. So you have young kids coming into an environment who are not likely to become lovers of reading. And many studies have shown that if by the time you hit the 4th grade, you're not a reader, the chances of you being a high school dropout magnify tremendously. So it's the kind of thing that we all have to get involved in and let these children know. And by the way, the first reading room in the Chicago area is opening next month. Christ Advocate Medical Center is behind that, and they're doing many scholarships. And you know, we're trying to get some partners for them, so we want everybody to get involved because we have so many young people with so much potential. And what people sometimes don't understand is that for every one of those young people that we keep from going down that path of self-destruction, that's one less person we have to be afraid of, one less person we have to protect our families from, one less person we have to pay for in the penal system or the welfare system, one more tax-paying, productive member of society who may discover a new energy source.
Yet, today, it remains that minority groups as a whole have rates of preventable hospitalization that's nearly twice that of whites, and comprise the overwhelming majority of the under and the uninsured. In your opinion, as the leading physician, I'm sorry.
Physicist. No.
What do you feel should be done to help fight the healthcare disparities?
Excellent question. And you'll read extensively about that in my new book called America the Beautiful, which is being released tomorrow. But one of the key things is recognizing that there are a lot of people who are, quote, uninsured, although there aren't really any because they go to the emergency room. But it costs 5 times more when they go to the emergency room than it does when they go to a clinic. So what I've proposed is that we have a health account for those individuals. We're all paying for it anyway, but we're paying premium dollars. So why not establish a fund for them, very much on the same model as the food stamp program, which is replenished at the beginning of each month. And now, when Mr. Smith gets that diabetic foot ulcer, instead of going to the emergency room and blowing half of his monthly account, he's going to go to the clinic. He gets the same treatment in both places, but in the emergency room, they treat him and send him out. In the clinic, they treat him and say, now, Mr. Smith, look, get your diabetes under control, so you're not back here 3 weeks with another problem. And we begin to deal a little bit with preventive health care and with maintenance of health care. That's where we begin to save a lot of money, because we as a nation spend twice as much per capita on health care as the next closest nation, and yet we have tremendous access problem. There's tremendous amount of waste, tremendous amount of fraud, tremendous amount of just inefficiency. And I think one of the things we need to do is to get more healthcare providers involved in healthcare. Because it's sort of like if the Golden Gate Bridge fell down, who would you get to rebuild it? You know, structural engineers or people who like to talk about building bridges. Well, you know, it's the same thing with healthcare. We need to get real people who actually understand it and who really know where the cost centers are to deal with it and not make it into a political football.
I want to know what dreams do you have right now? Because of course you must have some.
I do have a dream. I have a dream that I share with my wife that across the entire nation in every school, public and private, that we will be able to recognize students who achieve at the highest levels academically and care about others and put them on the same kind of pedestal as we do the all-state basketball player. is it that will allow us to maintain our pinnacle position in the world? Is it the ability to shoot a 25-foot jump shot, or the ability to solve a quadratic equation? And when we begin to emphasize that the right way, and the other, the humanitarian component, with our program, you have to have both the intellectual and the humanitarian. We cannot, and we must not, ever forget about the less fortunate people in our society.